Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. The focus of this presentation is diabetes and travel tips. There are a lot of times when you have to travel on a vacation, or you have to travel overseas, or you are just going across town to meet your kids and grandkids. But there are a lot of things you need to focus upon more than packing your luggage and shoes. So let us focus on some other things that are medically important to see what you need to have in your handbag, more so than what you have in your suitcase that is going to be checked in. So let us begin with the feature presentation. Diabetes, travel tips, and medicines, and much more. You can follow my green arrow here. Travel tips, medicines, and much more. So let us see some of the things that we need to be focusing upon when we are making travel arrangements. Before we do anything else, the most important thing is you need to have a carry-on handbag with a belt which you can put on your around your shoulder, and it is with you wherever you go, whether you're going for a hiking, whether you are going for to visit your kids, or whether you're going to overseas to meet your family. Make sure this handbag has your medicines, at least twice the amount of medicine that you need for the duration of your vacation. Make sure your pills are there. You also have your glucose meter to check your glucose. Have some liquids available, especially if you're on an outdoor settings. Make sure you have some snacks that are useful for you, because when you travel, you may not be able to find proper food for quite some time. And you also have some sugar cubes or something like that that you can use if you think your blood sugar is running low. Then, of course, proper clothing is very important, especially if you're on an outdoor hiking trip. Medications. I cannot overemphasize the importance of medicines. And make sure you can get a pill box like this with divisions for morning and evening, and put all your medications in the slot so that you don't have to remember or carry 10 different bottles in your handbag. You can just carry this little kit which has the medications for as many days as you require. Next, if you are going on an outdoor picnic, or if you are going during summer hiking or something like that, then you need to have hydration. Hydration is of paramount importance. I'm not talking about just drinking water. If you're outdoors sweating and you're drinking water, you're doing more harm to yourself than doing any good. So you need to have something like Gatorade or an electrolyte balanced liquid that will replace the sodium and potassium loss in your sweat. Again, since we are talking about diabetes, these things can apply to people with all kinds of medical problems like heart disease, heart failure, hypertension, or kidney problem, where you have to have close monitoring of your vital signs, and you have to take regular medications, and you have to monitor your bodily functions like your blood sugar, your body weight, and blood pressure, things like that. So if you're carrying your glucose meter, make sure that you have fully charged batteries in these if they use batteries. And if you're on an insulin pump, there are a lot of things that you need to focus upon besides taking your insulin pump with you, and I will touch upon that in a minute. And we talked about the next, snacks. You can have some low sugar, low fat snacks like these, which you can use when you're on the trip. If you think that you may not be able to find adequate food for a long period of time, or if you get trapped somewhere where you don't have a choice, and like airports, they postpone your flights and you're stuck there. And if you don't have any choice that is suitable, you can always use these low carb, low-fat snacks to supplement your nutrition. Here are some glucose tablets that you can carry with you, and you should always have glucose tablets if you have history of diabetes, because you do not know when your next meal is going to be available. You do not know what your blood sugar level is, because when you are traveling, you are burning a lot of calories, you are burning glucose. As a result, your sugars can widely fluctuate when you are traveling compared to when you are just sitting at home. Talking about travel. Okay, when we travel nationally and internationally, there are a lot of things that you have to take into time and make preparations for that. You need to be concerned about airport security, especially if you have this insulin pump, which is battery operated, and I'll talk to you in a minute. Time zones, because if you travel internationally, the time zones change, so your meals may have to be adjusted based upon the time zones, or you have meals at certain set intervals so that your blood sugar doesn't run too low. And sometimes you have to have some backup plans for your meals. You may have to pick up something from the airport if you feel that you're not going to get the right kind of food on plane, but most of the time you should be able to get good food on plane. Always have backup snacks in case you feel hungry or you feel like your sugar is running low on an international flight which might fly for 16 hours, something like that. Insulin pump. Insulin pump is an important thing that you need to take into consideration. You need to talk to your doctor or talk to the insurance, the company that supplied you the pump, and see what kind of documents you need for TSA scanning purposes. If the company says you cannot go through the X-ray machine, you need to have a documentation to show that you have this insulin pump, that you shouldn't be going through the X-ray scanners. And the TSA officers do understand, and they can do the body tapping instead of running you through that X-ray machine, because if your insulin pump stops, that could be a pretty significant problem at the airport. Always carry extra batteries for your insulin pump and also for any other purpose you need, for like glucose meter, something like that. All right, if you're outdoors, there are a few other different things that you need to take into consideration. You need to consider the weather, the temperature, the humidity, and heat. And you need to have hydration. I already talked about using electrolyte solutions, not just plain water. Make sure your clothing is appropriate to the weather, whether it's cold or too hot. And make sure you have a list of all your medications, ice packs just in case you get hurt, and epinephrine just in case you are exposed to some allergic reactions while you are hiking. And you should use your smartphone to the best extent to set up alarms for your meals, for your blood sugar check, and you can also make notes for yourselves. Save important information regarding your medical health in the form of take pictures and images, medication lists, your diagnosis. You should have your doctor's name, number, and a letter from your doctor if it is necessary for your medical condition. Like you have a pacemaker, then if you have a pacemaker insurance card from the pacemaker company or a letter from your doctor. Carry your insurance cards, because if you are traveling, you may need some medical help when you're at your destination. You can even make copies of your medical records and save them on your smartphone, because if you need medical help when you're outside of your home place, then you have all your medical information with you, and you can share that with the medical experts, medical facilities, in case you need emergency medical help. So ladies and gentlemen, there are a lot of things that we need to take into consideration, whether you have diabetes, heart disease, heart failure, kidney problem, or any chronic disease. You need to travel with the most important thing in your mind, that is to be prepared for your health, more so than whether you got extra dresses for the evening function. So you need to have your monitoring devices like blood pressure monitoring or sugar monitoring, then your medication lists, and you have to have the insulin shots, things like that. Always carry your medical cards, your insurance cards, your pacemaker card, or if you have a pump, if you have a card, carry those. Extra snacks and foods and plenty of fluids and good protective equipment, especially if you're going outdoor hiking or on an outdoor expedition. So ladies and gentlemen, this is a quick review of what are the things that you need when you travel with a history of diabetes, heart failure, heart disease, kidney problem, or any other conditions that need constant monitoring and supervision. Thank you so much, ladies and gentlemen. I am Dr. Nik Nikam. I hope this has been useful to you. We have many other presentations related to your health with reference to diabetes, high blood pressure, and heart disease. And please do watch them. And please do subscribe to our YouTube channel. And we will see you in the next presentation. Thank you.